Okay, so pre-eclampsic toxemia part 2. So from a naturopathic and functional lens perspective, preeclampsia can be viewed as the point at which placental stress exceeds maternal adaptive capacity. And 4 in particular maternal factors have been repeatedly emerging as contributors to that reduced capacity. So number 1, vascular and endothelial health. Preeclampsia is at its core a condition of endothelial dysfunction within the placenta. It's placental disease. Anything that compromises vascular flexibility, nitric oxide signaling, increases vulnerability, etc. So contributors such as chronic inflammation, insulin resistance, oxidative stress, micronutrient insufficiency, particularly magnesium and calcium, and this dovetails neatly with the biomedical understanding. It simply sort of zooms out and asks why some women tolerate placental stress better than others. Another factor we know contributes is those nutritional foundations. So pregnancy is a state of extraordinary nutritional demand, and oftentimes deficiencies will predate conception. Women are already low in certain minerals and vitamins before they even conceive the baby. So there are particularly key nutrients that we know are implicated in preeclamptic risk. So if a woman is low in calcium, low in magnesium, if her diet is low in omega-3 fatty acids, and also we know protein intake impacts. So we're not talking about we're not talking about an excessive intake of protein. We're talking about a consistent inadequacy of protein. So this is where 6 to 12 months of preconception healthcare, of preconception supplements is so beneficial to address such nutritional adequacy. And again, where, holistic integrative healthcare plays such a valuable role in allopathic modern mainstream obstetrics. And we also know, as per the previous part of this part 1 video, we know male health, the health of male sperm impacts a woman's risk factor of developing preeclampsic toxemia. So please, guys, if you are planning a pregnancy, 3 to 6 months for the men of preconception healthcare too. Next one that we know impacts is metabolic and glycemic balance. So insulin resistance and dysglycemia, which means abnormal blood sugar levels, increase that oxidative stress and endothelial strain. So from a wellness perspective, this means that we want to protect our metabolism in pregnancy. So things like prioritizing having whole foods, minimizing ultra processed carbohydrates, all to try and create and support stable blood glucose. And the fourth big one is stress physiology on the nervous system. So the HPA axis, that's what produces cortisol in our body. So the H is the hypothalamus, that's in the brain. The P is the pituitary gland, that's the master hormone regulator. And the A is the adrenal glands, which sit on top of the kidneys. Chronic psychological stress activates the HPA axis, elevating cortisol, elevating stress coping hormones, with that downstream effect on our blood pressure regulation, vascular constriction, inflammatory pathways, etc. So while stress itself does not directly cause preeclampsia, because preeclampsia is a disease of the placenta, stress does significantly reduce the maternal physiological reserves to manage those stresses and that any dysfunction or disease within the placenta, so it makes you a higher risk for developing preeclampsic toxemia, basically when her body can no longer compensate. Once preeclampsia is present, medical management leads. Full stop. That said, holistic, complementary, integrative naturopathic care can also still be a critical support factor, especially for stress reduction, sleep, rest, increased balance, high quality nutritional supplementation. You can never reverse PET, but it can be possible to sort of slow its progress of what it might have, been fulminating, rapidly worsening PET if we get on top of it and give your body everything it possibly can have to support it. So it's not soft science, it's just physiology 101. And that's why complementary holistic management of PET includes things like nervous system regulation, adequate rest, emotional safety, such as reducing all the unnecessary fear-based messaging. Wellness strategies can dramatically affect that, support that terrain in which the placenta and the maternal system interact. So we're talking about things like naturopathic medical herbalist, classical homeopath, Chinese medicine, acupuncturist, seeing them all, multi-prong approach, do everything you can to halt that PET getting worse. Pre-eclampsia can occur when a woman has done everything right. We know that. But the mother guilt of knowing you made intentional decisions not to do everything right will haunt you as a mother for the rest of your life. And when you're looking at that premature baby in NICU, covered in tubes, or when your child is given the diagnosis of dyslexia or dyspraxia or ADHD or a myriad of other brain dysfunctions, you will blame yourself for not agreeing to, or you'll blame yourself for the fact that you agreed that you were going to work to 37 weeks. What were you thinking? 37 weeks is fully term. You're due to have a baby at 37 weeks onwards. That's not early. What were you thinking? The SGA babies, the IUGR, the intrauterine growth restricted babies, the small gestational age babies, the born prematurely babies, the ones that have low APGAR scores at 1 minute and 5 minutes. They've got an APGAR score of 3 and 5 instead of 7 and 9. Your mother guilt will live with you in your subconscious for the rest of your life, girlfriend. It's just not worth it. It's not worth it for you. It's not worth it for your baby. In summary, preeclampsia is a placenta-led disease and it must be approached with clinical seriousness. It can be catastrophic if not treated properly. These days it is treated properly unless you are in a developing country and you can't get access to proper obstetric care. Risk screening, aspirin where indicated, surveillance, timely escalation. Once it's occurred, it's irreversible, and obstetric medicine then manages that disease. Expectant mothers should do everything in their power to strengthen that maternal vascular resilience through nutritional adequacy, metabolic stability, through good diet, increased sleep, reducing everything that you can stress-wise, through preconception healthcare. If you are planning to be pregnant, do it before you've actually conceived. Balanced pregnancy lifestyle and naturopathic supplementational care. And if then you're diagnosed, you can use that multi-prong approach. And hand on heart, you can say, I did everything possible to prevent this. And chances are you managed to prevent a far worse version of PET. Bye, everybody. And if you want to check me out, go to motherwise.app or kathyfray.com and lots of other resources there. Bye, everybody.